And with that, I yield to Congressman Cole.
Thank you very much, Madam Chair. I'd be remiss not to tell you I really like those glasses this morning. They're pretty sporty. They make a strong statement. I want to begin by thanking the chair for holding this important hearing today. Much attention has been given to the economic toll of the pandemic and the impact on physical health, and rightly so. However, we all know those are far from the only impacts. In fact, some of the more subtle effects are just being brought to light, and we may not know all of the consequences for years or even decades to come. However, the information that we have on some of these secondary impacts is concerning. Based on recent surveys, symptoms of anxiety and depression have increased considerably in our population. In addition, survey respondents also admitted having started or increased substance use to cope with stress or emotions related to the pandemic. Suicide is also increasing, particularly for adults aged 18 to 24 and for minority groups. Overdose deaths, which had just begun to show a small decline, have marked a reversal and are now on the rise again. Life expectancy is decreasing, reversing progress over generations. After a year of lockdowns, isolation, and physical distancing, the mental health impact is apparent. Families having financial distress are further burdened by feelings of exhaustion, frustration, and mental strain from coping for so long. Sadly, too many families are also dealing with the loss of a friend or a family member. Many children are deprived of the emotional support and social learning provided by in-person schooling. Compounding these issues is a lack of providers to address mental health and substance abuse. The United States continues to have a shortage of qualified providers, particularly for rural and other underserved areas. Addressing these problems is at the core of several programs in the jurisdiction of this subcommittee. In addition to our annual appropriations, the fifth coronavirus supplemental passed just 2 months ago included more than $4 billion in funding for these issues. Much of that funding is yet to reach local communities, but over the next few months should become available to address the rising rates of substance abuse and the need for mental health services. As states begin to reopen, businesses start the path of recovery, and schools resume in-person instruction, we can begin restoring some of the stability needed to return to normal. I'm encouraged by the continued efforts to vaccinate as many adults as possible, and the news that the timeline for widely available vaccine continues to shorten. We may be just a few short months away from having the necessary vaccine supply to meet all demand. Again, such an accomplishment speaks to the perseverance and resilience of the American spirit. I would like to extend a special welcome to Verna Faust from my home state of Oklahoma. Ms. Faust has worked in community mental health for over 30 years and runs one of the largest behavioral health and substance abuse facilities in the state with 26 locations across Oklahoma. As a certified community behavioral health clinic, Red Rock provides a range of services, including outpatient, crisis stabilization for adults and youth, substance use, residential treatment, prevention, and housing. Red Rock was recently recognized as one of the top workplaces in Oklahoma, and Newsweek ranked Red Rock as one of the best addiction treatment centers in the United States. I also want to thank the chair for taking such a bipartisan approach in this hearing cycle. I've enjoyed the panels put together, and I know members appreciate the ability to have input on the topics covered and the joint selection of witnesses. I've always said that we may not agree on everything, but the chair and I have always worked well together on the many areas where we have bipartisan agreement. And I appreciate her thoughtfulness and will always work with her on our shared priorities. With that, I want to thank all our witnesses for speaking today, and I yield back the balance of my time, Madam Chair.